Hello and welcome to the video. In today's video, we are going to briefly discuss COPD, also known as chronic obstruction pulmonary disease. This condition mainly affects the respiratory system. It has been estimated that approximately 24 million Americans have COPD. If you believe you have this condition, then schedule an appointment with your healthcare provider. Your provider will more than likely refer you to a pulmonologist who will order specific diagnostic tests, which will give greater insight into your cardiovascular health. Now, let's move on to the video. Let's cover what is COPD, or chronic obstruction pulmonary disease. Chronic obstructive pulmonary disease, COPD, is a chronic inflammatory lung disease that causes obstructed airflow from the lungs. It is primarily caused by long-term exposure to irritating gases or particulate matter, most often from cigarette smoke. Other contributing factors can include air pollution, workplace exposure to dust and chemicals, and genetic factors. COPD is characterized by symptoms such as shortness of breath, especially during physical activities, wheezing, chest tightness, chronic cough, often with mucus, frequent respiratory infections, and fatigue. The two main conditions that contribute to COPD are emphysema. This condition involves the destruction of the alveoli, air sacs in the lungs, leading to difficulty in breathing out air. Also, chronic bronchitis. This involves inflammation of the lining of the bronchial tubes, which carry air to and from the alveoli, resulting in persistent cough and mucus production. Now, let's talk about treatment. Treatment for chronic obstructive pulmonary disease, COPD, aims to relieve symptoms, improve quality of life, and slow disease progression. The treatment plan typically includes a combination of lifestyle changes, medications, and therapies. Here are the main components of COPD treatment. Smoking cessation. The most crucial step for people who smoke is to quit smoking, which can slow the progression of COPD. Avoiding lung irritants. Reducing exposure to pollutants, chemicals, and other lung irritants can help manage symptoms. Healthy diet and regular exercise. Maintaining a balanced diet and staying physically active can improve overall health and lung function. COPD is also treated with medications. Bronchodilators. These medications help relax the muscles around the airways, making it easier to breathe. They can be short-acting, for immediate relief, or long-acting, for maintenance. Inhaled steroids. These help reduce airway inflammation and can be combined with bronchodilators for better symptom control. Phosphodiesterase 4 inhibitors. These help decrease airway inflammation and relax the airways. Theophylline. This medication helps improve breathing and prevent exacerbations, but is used less frequently due to side effects. Antibiotics. These may be prescribed during exacerbations caused by bacterial infections. There is also pulmonary rehabilitation. This is a comprehensive program that includes exercise training, nutritional advice, education, and support to help people with COPD manage their condition and improve their quality of life. For people with severe COPD and low oxygen levels, long-term oxygen therapy can help improve quality of life and extend survival. Here are several key points to remember about chronic obstructive pulmonary disease, COPD. COPD is a chronic inflammatory lung disease that obstructs airflow from the lungs. Primary causes include long-term exposure to irritating gases or particulate matter, most commonly from cigarette smoke. Other factors include air pollution, workplace exposure to dust and chemicals, and genetic factors. Common symptoms include shortness of breath, chronic cough, often with mucus, wheezing, chest tightness, frequent respiratory infections, and fatigue. COPD is a progressive disease, meaning it typically worsens over time. Early detection and management are crucial to slowing progression. While COPD is not curable, its symptoms and progression can be managed with lifestyle changes, medications, pulmonary rehabilitation, and, in severe cases, oxygen therapy and surgery. That will conclude today's video on COPD. Thanks for joining us today. Don't forget to hit the subscribe button and the notification bell. We greatly appreciate all of your support and look forward to seeing you all in the next video. Feel free to share your thoughts and comments below. Until next time, see you then.